Dr. VanDyke here. I've got one other point I want to make about hormone imbalances, this generalized term. I want people to be aware that there are times when it's appropriate for hormones to shut off. And usually, these are times of great stress. So, for example, if a guy is critically ill, he's in the intensive care unit, maybe he's got pneumonia, needs a ventilator or something, and then he survives that and gets out of the hospital and is trying to recover at home, and somebody checks that testosterone level, that testosterone level is going to be so low. But this is a normal thing. This is the body compensating. The body literally is like, I don't have time for this testosterone over here because I got to deal with this. And when it's done dealing with this, then it will go back to doing its usual job in the testosterone world. So there's a few things that are like that. You know, that testosterone is the best example, probably. There is a change in thyroid hormone. Your thyroid is going to naturally downregulate when you're acutely ill. It will shunt off T4 into a kind of an inert pathway called reverse T3. And it will downregulate the TSH, which is asking for thyroid hormone. And the principle is the same. The body's like, I got to deal with this problem over here. Let's just kind of like slow things down a bit, cool it off, and then we'll get back to that later. And then it does. The thyroid hormone does just resume its usual process after you've recovered from this illness. Estrogen is a nice example. There is a type of amenorrhea or lack of periods that's due to the hypothalamus kind of shutting the whole process down. And classically, this is happening in very elite athletes. So long distance runners or ultra marathoners, major triathletes, and classically even gymnasts. The body's like, listen, man, this is intense. I'm going to work on this right now, and we'll have some estrogen later. And it happens in gymnasts too with the way that they grow. Their growth will kind of be slowed down until they're done with intense gymnastics, and then the body kind of kicks back in again. So be aware if somebody says, oh, your level of something has tanked, and you've been ill recently, had a major surgery, or you went and ran your ultra marathon, or something stressful has happened, it might just go away on its own. And so sometimes it's worth just taking a pause and checking again in a month or 2 or 3. So I hope that helps clarify certain hormone imbalances that we expect to happen and are physiologically appropriate and self-limiting.